Hello, Star Scholars Network family around the world. This is Dr. Sanjeev Sapkara, the Vice President of the Star Scholars Networks for Public Health, also the Chairperson for the Health Committee of the Non-Resident Nepali Association, and I'm the recipient of the Global Health Award of Star Scholars Networks for 2019. Today, I'm going to give you some update on the coronavirus pandemic and message to the Star Scholars Network family around the world. Um, let's begin. Around the world, we have close to 2 million cases of infections due to this novel coronavirus that started 4 months ago. And the number of deaths had actually, unfortunately, risen more than 112,000. And almost 2.8 million around the world has been tested, but the cases are approaching 2 million cases. So my message again to everyone out there listening to me around the world is your chances of getting infection is very high if you are a healthy person not infected with coronavirus infection. Your chances has your risk of getting infection has almost quadruple or gone 5 times, or even in some places 10 times when it was compared to like 4 weeks ago. It may have been no risks, or almost the double risks. Now the risk has gone multiple times. Why I am saying so is because there are many people out there who are infected. They are not showing symptoms. Those who are seeing symptoms and those who are actually in sick, they stay home and they stay away from the crowd and public. But there are people who are infected but do not do show symptoms, or still do not know that they have infection. Those people are out there in public places, groceries, pharmacies, and we get infected by them. So the message is, do not go out, stay isolated, stay away from the crowd or public places. If you must go out, cover. Now look at this map. United States, the cases are almost 500,000 cases are there of corona infection. Western Europe, Italy, Germany, Belgium, France, Spain, United Kingdom. Every place has thousands and thousands, or even tens of thousands of cases of infections. So if you are not yet infected, then your chances of getting infection is very high if you are in these countries. If you go out and do not take measures. And what are the measures that you need to take? Are actually let me show you this picture. It's take cover. First of all, do not go out. Stay away from the crowd or the public places as much as you can. If you must go out, cover your nose, mouth, and eyes. Do not worry if you do not have surgical masks or sophisticated masks. Just wear what you have, like a handkerchief or a scarf or any cloth masks that work. That's to cover that. Why cover helps? It actually helps you from getting direct droplets from the infected people. If an infected person comes close to you, or if you go too close to them, and if they breathe on you or talk to you, or if they are in a cough or a sneeze, then those droplets do not come directly on your mouth, and you are protected. B, how it's going to help is you do not directly touch your face and nose with your hands, because your hands are the carrier of the virus. If you touch your places, surfaces, and if the surface has virus, and then if you knowingly, unknowingly, you touch your mouth, if you have a cover, then it actually prevents the hand to going directly to the mouth. That's how it's gonna help. So always cover. Second, if you must go out, cover, and whenever in the next opportunity, wash your hand. In the bathroom and public places, use soap and water to wash your hand for almost 20 seconds, for more than 20 seconds. Why? Soap and water, because soap kills the virus. Hand sanitizers also kills the virus if it has more than 60 to 70% of alcohol. But the best is soap and water that kills. That's the message. Again, here I'm showing who are the spreaders, the people who are not showing symptoms, or people who are asymptomatic, or people who are pre-symptomatic. They have the disease, they have the infection, but not showing symptoms, or they feel they are healthy. Or people are showing symptoms, but they are not they are denying and coming out to work. So those are the people who are infected, and if you are healthy, if you're not infected, your chance of getting infected with them is very high. Again, that's the reason why the cases are increasing. Again, who are more prone to get infected. Go get sick and hospitalized as we age. The younger the people, in the lesser chance of getting hospitalized if you are infected. But as the age advances, there are other diseases actually kick in as well. If you're hypertension, if you're diabetes and asthma, lung disease, then your chances of getting hospitalized is high. So as the age increases, so does the hospitalization increases with the infection. Young people are not totally immune. Don't assume that they are not impacted. They are infected, but their chances, they are relatively less in numbers compared to other ages. But children are affected as well. Um, Other is, I get a lot of questions. When's this gonna end? When this pandemic gonna end? The simple answer is we do not know. Not only me saying that. You ask any experts, they can say they do not know for sure. Why they say so? Because this is a new virus. We did not knew this virus existed more than 4 months ago. So its behavior characteristics we are just learning. But what we can say that this virus belongs to the same family as that caused the SARS 2003, 2002 and 3, MERS 2012, and this is the same virus, the same family that causes the common cold, the cold as well. So looking at their behavior, what we can see is the more the social distancing we practice, more we are careful, staying away from the longer we stay away from the crowd, the longer the social isolation or the lockdowns are, the lesser the numbers are going to be after that. So that's the reason why we need to do social distancing for a long time. This graph shows the graphs from 1918. Yeah, look, come 1918. That is showing that there are four cities here: Philadelphia, St. Louis, New York, and San Francisco. And the shaded portion is the number of weeks of social isolation. The longer the social isolations in 1918, almost 100 years ago. After the social isolation, the curve has gone down, the number of cases has gone down. So the answer to the question when this is gonna over, more the social isolation and the social distancing we practice, longer we practice, better the outcome gonna be. This shows how rapidly it is that the cases are doubling. If you show the graph, it took almost like 2 months for the number of cases to double, but then it only took like 10 days to double after that. So the point is that the rate of infection is rapidly increasing. The chances of getting infected very high. So your chance of getting infection, if you are not infected, is very high if you go out. So you have to take all the measures. I'm never too tired of saying this, that we are not taking enough precautions. We know how it's gonna infect it, how we are not infected, but still, if we get infected, then this means that we are not practicing what we are learning. So we need to practice. Stay away from the crowd. Cover your face. Wash hands for more than 20 seconds. And that's what's gonna prevent us now. The symptoms are, most of the people get cough, fever. Those who are severe cases got difficulty breathing. Some get diarrhea, GI symptoms, but not all get all the symptoms. Again, most get cough and fever. Again, this graph shows children are not immune. They are showing the black number shows the children who are not hospitalized yet, but they are infected. Blue shows they are infected and hospitalized. The light blue shows they are in ICU. So children are affected, impacted. They are not immune. We have to protect the children as well. The drugs and medications out there, the best to lower the symptom that fever is Tylenol or acetaminophen or any brand that you can find of acetaminophen. Ibuprofen, some people were saying there were some studies that it may harm, but there is not strong evidence out there. Even CDC was saying there is no strong evidence that the ibuprofen is going to harm. So take Tylenol for sure, but if you do not have it, then ibuprofen is going to work. The anti-malaria drug, some say that it might work, but we do not have the clear evidence for that. If you really want to try, if you're infected, then you have to seek your doctor's advice. If the doctor prescribes it, then you can take it. But again, you need to bear in mind that it has lots of side effects as well. So it's your doctor who's gonna direct you whether or not you need to take anti-malarial if you are infected. The Ebola virus antiviral remdesivir, it may work, it may not work. People are trying. Again, your doctor is the best advice. There is some articles out there. The people who are taken BCG, anti-tuberculosis vaccine, it might help protect them. We have seen some results that the countries where BCG, the anti-tuberculosis vaccine, is mandatory. Those countries have shown we have seen less number of cases out there. But again, they are not totally immune. There are people who are, so we do not know yet that the anti-tuberculosis vaccine is going to work. But do not assume that you have taken anti-tuberculosis vaccine and you are totally protected. Again, this graph, this table is showing the countries and the number of beds they have, and number of ICU beds they have, and number of ventilators they have, and each of the countries has its own numbers. That's what it is showing here. And each country, some have enough ventilators, some do not, some have enough ICU beds, some do not, and these countries are working towards increasing and escalating the numbers there. This graph showing how many infected per million. In the United States, almost 1,500 people are infected per million. In Turkey, showing 500 people are infected per million. So in general, 0.5, 0.1 to 0.05 people are infected. But this table is showing if you are. People ask how many ventilators do we need, how many hospitals do we need, how many ICU beds do we need. The answer is more the social distancing, more the social mitigation we practice, lesser the number of hospital beds are needed. So let's say in a country where there is no practice of social distancing at all, there are no lockdowns, no social isolation, then 1 to 5% people are infected in the population. Of that, 20% are hospitalized. Among the hospitalized, 30% are needing ventilator in ICU, and in ICU, again 11% of people are dying. If you are practicing 4 to 8% of the social distancing, the model shows 0.5% up to 0.5% of people are infected, and again of those 20% are hospitalized, 25% are needing admitted in ICU of those who are hospitalized. If there are more than 8 weeks of social distancing, then it's better. Only 0.1% of people are infected, 20% of them getting hospitalized. The hospitalization rate and the ICU number of rates stays the same, but number of infections be lessened. So public health works here. If you want to lessen the burden to the hospitals, social distancing. And so more social distancing, more the prevention we have, lesser the load on the hospitals and medical care. So that's the message out here. Some other thoughts and considerations. The Google and Apple have teamed up to bring up a app to tag the people with corona infection. That means if you have an app, you are able to track if you are nearing a person who are infected or diagnosed with the corona infection. Again, we do not know if this app worked for sure. There may be many false positive or false negative cases as well. We have to see, but they are working on this app. Another thing about herd immunity. What is herd immunity? The phenomena of if 50% of the population is infected, then those who are not infected are automatically protected. That's the concept of herd immunity. That it has worked in chickenpox and other diseases, but we do not know if it works in the corona infection. Some people and some articles are out there to practice chickenpox party, meaning that we deliberately get the infection so that those who are not infected are protected. So that is a very risky and very dangerous thought. I do not recommend at all doing the herd immunity for the corona infection, because there are so many adverse consequences, health hazards if we deliberately or knowingly get the virus, because your chances of getting very severe, hospitalized, and ending up in ICU is very high. If we deliberately get infected. So do not practice herd immunity or chickenpox party for corona infections. Again, my name is Sanjeev Sakura. This is actually a message for the global family of star networks out there. I wish you all the safety and good health. Stay safe, and we are there out there for you with the message. This is gonna get over soon, but we have to practice as much of social isolation as much possible. I know people are getting frustrated. There are mental health issues coming up, but it's gonna get over if we are very careful, and if we are becoming more patient of social distancing, because that's what's gonna prevent us. That's what's gonna prevent us from getting to the hospitals. Thank you.